So we're going to move on to our lecture recording that includes labor and delivery. We call that parturition, the labor and delivery part. And that term is in our program of studies, so we do have to make sure we're comfortable with that. But we're going to start before that with things that can influence fetal development while the baby is still in utero, obviously. So one of the things that we take a look at is what kinds of things can impact the development of a fetus in a negative way if the mother is exposed to these things during fetal development. And there is a term that we use for anything that can cause malformation of a fetus during pregnancy, and that is called a teratogen. Okay, so a teratogenic agent, as it says here, is anything that can negatively impact the development of the fetus, resulting in some type of malformation. So that could include physical malformations, that can include cognitive or brain malformations. Just depends on what type of teratogen it is. So what are some of the teratogens that can affect babies during their development in utero? Drugs, and keep in mind that that doesn't just include drugs that are illicit. It also includes pharmaceuticals, prescription medications as well. Viruses, okay, certain viruses are very harmful if the baby is exposed to them, primarily in that first trimester of development. Radiation, so if you think of exposure to x-rays, for example, during that first trimester of development, that can be very harmful to a baby as well. So all of those things collectively are called teratogens because they can actually cause malformation in the fetus before the baby is born. And one thing that's really important to remember relates to this second bullet here. Teratogens have the most catastrophic effect when they are present in that first trimester. So I'm going to think about that for a minute. In that first trimester, that's when we have rapid development of the fetus, rapid development of the brain, of the limbs, of the internal organs, of the skeletal system. All of those things are rapidly developing in that first trimester. And once we leave that first trimester, then a lot of it is about just finishing up the development of those organs, growth, gaining weight, getting bigger in size, etc. And so it's really important to remember that it's that first trimester that if the baby is exposed to a teratogen during that first trimester, then that is when the impact of that teratogen is potentially the most catastrophic. A few examples of teratogens that are known teratogens include rubella, which is commonly known as the German measles. So in our part of the world, we would receive a vaccination when we are younger for measles, mumps, and rubella. And German measles or rubella is particularly impactful during that first trimester if the mother happens to contract German measles or rubella during that first trimester. And one of the very negative consequences that can result of exposure to rubella during pregnancy is the baby can quite often be born with malformed cochlea or no cochlea at all, which we know results in deafness. Thalidomide is another very well-known teratogen because of the catastrophic effects that it had on limb development in babies during the 60s and 70s, 50s a little bit as well, when women were given this drug to combat morning sickness. So of course, when is morning sickness particularly the worst for most women? It's during that first trimester. And so women were prescribed this anti-nausea medication to combat that morning sickness and the vomiting and all of that and make them feel better. But it was unknown to scientists at the time that this particular teratogen actually caused limbs to develop abnormally in children. So babies were born with no arms, babies were born with no legs, or just like partial arms, etc. Again, depending on when the mother was taking the medication and how strong of the dosage the mother received. And there is a really good little video on teratogens that we will watch in class. One of the things to keep in mind, though, is in our program of studies, it actually doesn't require you to know any of the specific teratogens, so you'd never be asked to know what rubella is, to ask what thalidomide is, but you can always be given a context box that describes those things to you, and then you have to be able to think about, oh, okay, this is a teratogen, because that word you need to know, and oh, this is something that would affect the baby mostly in the first trimester, okay? So it's all about just making sure that you are being able to put those pieces together, but you don't have to memorize any specific teratogens. So moving along then, of course, besides medications, etc., the mother's behavior during or maternal habits during fetal development can also be impactful. So for example, if the mother uses drugs and Keep in mind that this also means pharmaceuticals that are potentially prescribed, things like opiates, morphine, street drugs, etc. Babies can be born addicted to these medications. They are typically born premature, underdeveloped, and sometimes having to withdraw, go through the symptoms of withdrawal as they get those drugs out of their system. Smoking is in the research, because it's been around for a really long time, and the research has been ongoing for a long time, is very well established as a teratogen, and there's a very high risk of premature delivery, reduced birth rate, miscarriages in the first trimester are much higher among women that smoke than women that don't smoke. Nicotine, carbon monoxide, all of that inhaled during pregnancy goes into the bloodstream and reduces the oxygen for the fetus, hence the low birth weight and the premature delivery. Alcohol is one of the more catastrophic teratogens, particularly when consumed in excess in that first trimester. It can result in something called fetal alcohol spectrum disorder, which has profound physical and most importantly cognitive consequences for the unborn baby. So now we'll shift gears a little bit from the teratogens and the maternal habits to labor and delivery, which is properly titled parturition. And so assuming that everything goes well and the baby is healthy and there's no complications, then labor and delivery pretty much goes as follows. So from a hormonal standpoint, remember, we're going to see those levels of estrogen and progesterone decreasing rapidly as we head into labor and delivery. And then we're going to see levels of relaxin and oxytocin increasing, okay? So big drop in progesterone and estrogen, big bump up in the levels of relaxin and oxytocin. We talked about these a little bit before, but as the name implies, relaxin relaxes the pelvic ligaments, which helps widen the birth canal, so literally helps those pelvic bones move apart so that the baby's head can fit between the two sides of the pelvis, and also helps relax and elasticize the cervix as well, so that the baby can pass through the birth canal. Oxytocin is more about contractions of smooth muscle. So remember, we talked about this a little bit already with breastfeeding. It causes the glands in the breast to express milk when the baby is latched on and feeding. And oxytocin, as it increases in the bloodstream, is going to cause stronger and stronger uterine contractions. We need that uterus to contract to help expel that baby out of the uterus. And the other thing too with oxytocin that's important to remember is that this is a positive feedback loop. And remember what that means. A positive feedback loop takes us further and further and further away from homeostasis. In this situation, the goal is to make those contractions come quicker and stronger and closer together, so the baby can be moved out of that uterus and out of the birth canal as quickly as possible, so that there aren't any complications with that. So remember what happens there. The uterus contracts, the brain, the hypothalamus, receives information that the uterus is contracting, and it prompts that anterior pituitary gland to secrete oxytocin into the bloodstream. That oxytocin travels to the uterus, causes more contractions. The brain receives that information, tells the pituitary to send more oxytocin. So it's constantly taking the mother further and further away from homeostasis, hence that positive feedback loop. Now, at the very beginning, uterine contractions will be quite far apart, but as the amount of oxytocin increases in the bloodstream and the labor kind of increases in the length of time, those contractions are going to be stronger and come closer together prior to. The other thing that quite often happens prior to significant contractions is the amniotic sac will break, and that fluid will come out of the uterus and out of the cervix and out of the vagina, and that would include the cervical plug, which is a mucousy-like plug that keeps the cervix closed and intact. That will also be released. And sometimes we refer that as, water breaking. You might have seen that on, television shows or whatever, that the pregnant woman all of a sudden is kind of sitting in a puddle of water, and that's because that amniotic sac has broken, and that right away is like, oh, okay, labor is coming, and then the mother will typically get herself to the hospital. As the cervix expands, doctors will keep an eye on how many centimeters the cervix is dilated, because again, that's another indication of how soon the actual delivery is going to happen. So if the cervix is only like half a centimeter dilated, the pregnant mother still has a ways to go before she's going to actually have the baby. And but if the mother's like cervix is like 8 centimeters dilated, that baby's coming like right away. Typically the first pregnancy for most women, because all of the muscles and ligaments and everything are really intact and haven't been exposed to relaxin previously, typically that first delivery will last a little bit longer. But when women have subsequent births, then quite often those will happen faster. The cervix will dilate quicker, the ligaments relax easier, and it just, everything happens a little bit more quickly. Again, that's a generalization. Remember, these things always vary from individual to individual, and of course birth to birth. So when we talk about the stages of delivery, it basically breaks up into 3 stages. The first stage is dilation, and this is when the cervix begins to expand. So remember, contractions have already started, the amniotic sac has already broken, okay, and oxytocin is in the bloodstream. So now we're kind of getting closer towards the delivery stage. But that first stage, when the cervix is dilating and we have those contractions, that can last anywhere from 8 or even less to 24 hours or more. There's a very broad range of how long that can actually take. Stage 2 is the contractions, okay? So the contractions happen every 1 or 2 minutes, really get closer and closer together when the baby is, is imminently going to be born. If a baby is born breech, that just means it's coming out either bum first or legs first. And quite often in this day and age, doctors will elect to form a cesarean section, which of course means they make an incision through the abdominal cavity and through the muscles and everything of the uterus to pull the baby out that way, to prevent any danger of the baby getting stuck in the birth canal and the mother and baby, mostly the baby, dying as a result. During history, women have always been vulnerable because of childbirth, because before cesarean sections were perfected, if a baby was born breech, it quite often meant death for the baby and sometimes even the mother, okay? The third stage is post-delivery. So this is once the baby's been born and is out and the umbilical cord is cut. Then what has to happen is this structure here called the placenta. Sometimes it's called the afterbirth. This has to be expelled out of the uterus as well. And so the doctors will quite often massage or manipulate the top of the uterus from externally on top of the woman's body. And that's to encourage the uterus to kind of give a last couple contractions to get that placenta out. And then the doctor will actually, or a qualified nurse will actually examine the placenta to make sure that it's intact and there's no like broken pieces or anything, because if there is some of that tissue that stays inside the uterus and it goes undetected, it can actually start to decompose in there. I know that sounds kind of nasty, but it can actually start to decompose in there and result in a very serious infection and even death for the mother. Okay, so they always make sure that that placenta is delivered. So if we look at a little graphic here, and this has a little bit more specific terminology. So stage 1 is called the latent phase and the active phase. So cervix relaxes, it starts to dilate, and that mucus plug is gone. And this is, like we said, is the longest stage. Notice how the baby's turned here. So in the later weeks of pregnancy, the baby will typically turn so that its head is down towards the cervix, and it puts pressure, of course, on the cervix prior to delivery. Stage 2 is called the expulsion stage. It sounds like the baby's getting like kicked out of school or something. It's called the expulsion stage, and you can see here that we call this crowning, when we can start to see the baby's head coming out of the birth canal, and this is when the mother is asked to push, right? So when you see in those movies and everything, or if you've been present for a birth of your mom or something like that, the doctor will tell the mother to push to help aid the movement of that baby out of the birth canal. Once the baby is out of the birth canal and has been delivered, then the umbilical cord is cut and tied, and then of course we have the delivery of the placenta. So once again, as we said, that's very important that afterbirth comes out so that there isn't any remaining tissue inside that uterine cavity to potentially cause infection. After birth, the mother will start the lactation, okay, which is the milk production. So in terms of our hormones, remember that we have prolactin. So we learned about that one already. Prolactin is one of those anterior pituitary hormones, and this actually targets the mammary glands in the breast tissue of the mother to actually begin making milk. And when the baby latches onto the nipple to begin feeding, literally what that does is a nerve impulse is sent to the brain, and then the pituitary releases that oxytocin hormone. So we already talked about oxytocin in terms of uterine contractions during delivery, but it also causes weak contractions, so it's not painful, just weak contractions of the smooth muscle in the breast, which actually pushes the milk into the milk ducts so that the baby can actually feed on the mother's breast milk. And so again, that's a positive feedback loop. So the more the baby feeds, the more oxytocin is released and the more milk is expressed. And then once the baby stops feeding and unlatches, then of course because that stimulus is no longer there, that message is no longer being sent to the brain that there's a baby feeding, the oxytocin production decreases until the next feeding. We talked a little bit about this in Biology 20. The very first material that comes out of the breast is called colostrum, and it's not really breast milk. It's more like a thickish fluid that is very important for the baby when the baby first latches on. So even if mothers don't plan on breastfeeding for whatever reason, they are encouraged by doctors to at least get the baby to latch on and get that colostrum for the first couple days. It contains sugar and proteins, which really helps the baby in terms of energy and growth, but most importantly, it has antibodies. And so as the mother has kind of lived her life and acquired antibodies due to vaccination or exposure to illnesses or whatever the case is, those antibodies are actually passed on through that colostrum to the baby. So the baby actually gets the blueprint of those antibodies, which really helps boost their immune system. And that is something that we call passive immunity, because the baby actually isn't exposed to an illness or a vaccine that stimulates their own immune system. It's actually literally antibodies being passively passed on from the mother to the baby through consumption of that colostrum. And so it is considered to be very important. There's no fat in the colostrum. The fat will come later. Of course, breast milk is very fatty because it's very dense in calories and really helps the baby in terms of growth. That first year of growth after birth is the most significant and most rapid growth that the baby will ever have in its lifetime.